Okay, so you've shared some fascinating material with us about something called blind quiet eye, and we really want to explore that today, get a handle on what it actually means for pets.
Right. It's a term that can sound a bit confusing at first, maybe.
Yeah, so let's unpack it. From the info you sent, it sounds like blind quiet eye is when a dog or cat loses vision, either one eye or both, but there aren't those obvious external signs you'd normally expect, like no redness, no swelling, that kind of thing.
Exactly. And that's the key, the quiet part. It means the problem isn't necessarily visible on the surface. It's not really a specific disease itself, more like a description of a symptom where the cause is hidden.
Ah, okay. So the actual issue could be happening deeper inside. The information suggests maybe the eye isn't focusing right, or perhaps the retina at the back isn't detecting light.
Yeah, or the optic nerve isn't transmitting the signals properly, or even, the brain isn't interpreting those signals correctly. It involves the nervous system and the ophthalmic system.
But without the obvious eye problems, which really shows how, well, how connected everything is, doesn't it? A problem somewhere else impacts vision.
Absolutely. It's a great illustration of that interconnectedness.
And it seems this can happen to pretty much any dog or cat. Age, breed, doesn't necessarily matter.
Broadly, yes, but some causes do have predispositions. We definitely see certain things more in specific breeds or at certain ages.
Like cataracts, for instance,
Mm.
or PRA, progressive retinal atrophy.
Exactly. Those often have genetic links tied to breed and age. And then you have things like SARD's sudden acquired retinal degeneration syndrome that tends to hit older dogs more often.
Okay. And there was also mention of congenital optic nerve hypoplasia, so born with it.
Right, underdeveloped optic nerve from birth. So, yeah, while any animal can be affected, there are definitely patterns depending on the specific underlying cause.
Got it. So our mission here for this deep dive is to really pull out the key insights from all this info so you, listening, get a really solid, clear picture of blind quiet eye. Maybe we should start with what someone might actually see or
Hmm.
notice in their pet.
Good idea. The history is often quite revealing. Owners might mention, their pet starting to bump into things, furniture, walls.
Uh-huh. Or just seeming clumsy, more so than usual.
Yeah, or maybe they're suddenly hesitant to move around, especially like when it gets dark or in dimly lit rooms. These can be the first clues. Subtle changes.
And if you take the pet to the vet, what are they looking for during the exam? The notes say the findings can vary a lot depending on the cause.
They certainly can. But there are a couple of key neurological tests related to vision. One is the menace response.
That's the blinking when you move your hand towards the eye quickly.
Exactly. A sighted animal usually blinks or flinches. And the other is visual placing. If you lower a pet towards a surface, they should normally reach out with their paws.
Okay, so if those responses are weak or absent, that points towards a vision problem, even if the eye looks okay.
It's a strong indicator, yes. Suggests the visual pathway isn't functioning correctly somewhere along the line.
All right, so we have some signs. Let's dig into the causes now. It looks like we can group them by which part of the visual system is affected,
Mm?
starting with the lens.
Makes sense. The lens is right at the front, focuses the light. So the main issue there is cataracts, the lens getting cloudy.
Right, but the info says it usually needs to be a complete cataract to cause blindness, not just a bit cloudy.
Generally, yes. Significant opacity across the whole lens is usually needed to block enough light to cause blindness. Partial cataracts might just reduce vision, make things blurry.
So noticing any cloudiness is important, but it might not mean total blindness yet.
Precisely. Early detection and monitoring are key. There's also a rarer lens issue, mentioned loss of focusing power. Not usually causing blindness, but significant farsightedness. Maybe after surgery or if the lens shifts position, luxates.
Okay, moving deeper then to the retina. This sounds like a common area for these quiet problems.
It really is. The retina converts light to signals. Several conditions here.
Uh-huh.
You mentioned SARDs in dogs and PRA with its genetic links.
What else affects retina?
Retinal detachment is a big one where the retina actually pulls away from the back of the eye.
That sounds serious.
It is. Then there are nutritional things like taurine deficiency, especially important for cats. They need it in their diet.
Right, and some toxicities too, like certain antibiotics in cats or ivermectin.
Yes, and rofloxacin in cats and ivermectin in both dogs and cats, particularly at high doses or in susceptible animals, can cause retinal damage leading to blindness.
Okay, so lens, retina. What about the optic nerve? The cable sending signals to the brain.
Another crucial spot. Inflammation of the nerve optic neuritis is a key cause. Also, growths, neoplasia affecting the nerve, and trauma, physical injury.
And we mentioned optic nerve hypoplasia being born with it underdeveloped. Lead poisoning too, apparently.
Yes, lead toxicity can affect the optic nerve. And an interesting point from the sources, potential damage during eye removal surgery, enucleation. If there's too much traction,
You could damage the other eye's nerve, or where they cross over, especially in cats or flat-faced dogs.
exactly, it's a known risk, particularly in those cases. A really critical surgical consideration.
Wow, okay. And finally, problems actually in the brain, central nervous system issues.
Right, CNS causes. This leads to something called amaurosis. If there are lesions or damage in the parts of the brain that process vision, the optic chiasm, tract, radiations, or the visual cortex itself, that can cause blindness too.
And it seems like problems higher up in the brain, past where the nerves cross, might cause more sort of vague visual issues, not always complete blindness.
That can happen, yes. More like disturbances, difficulty processing what they are seeing.
Okay, so we've covered a lot of ground on what can go wrong. What about why? Are there risk factors that make an animal more likely to develop these things?
Definitely. This is where we connect it back to overall health. For example, poorly controlled diabetes is a major risk for cataracts.
Makes sense. And we talked about genetics for cataracts and PRA. If it runs in the family, higher risk.
Absolutely. Also, systemic hypertension, high blood pressure, that's a big risk factor for retinal detachment, especially in cats, often linked to kidney disease or hyperthyroidism.
So treating the high blood pressure could potentially prevent the blindness.
Potentially, yes, or manage it. And finally, lack of oxygen to the brain, CNS hypoxia. Sometimes blindness can become apparent after, say, deep anesthesia or if an animal is revived after cardiac arrest.
It really drives home how systemic health impacts everything, even vision, in this sort of hidden way.
It really is.
So let's imagine a pet owner sees these subtle signs. The vet exam hints at vision loss without obvious eye disease. How do they actually figure out which of these many causes is the culprit? What's the diagnostic process like?
It's a process of elimination and specific testing. First, you rule out things that do cause obvious signs, even if vision is affected, like anterior segment inflammation or glaucoma. You'd usually see redness, maybe a cloudy cornea, eye pain with those.
Okay, so check for the obvious stuff first. What else?
Well, consider the animal's age. Very young puppies or kittens might not have a fully developed menace response yet, but they can usually still get around okay.
Good point.
And if the animal seems confused or generally off mentally, that can make it tricky to assess vision accurately. Also, temporary blindness can happen right after a seizure. Postictal blindness. Need to rule that out too.
Got it. Does how the blindness appeared give clues? Like, did it happen overnight?
Hugely important. Sudden onset hours to maybe a few weeks points towards things like optic neuritis, retinal detachments, SARDs, or maybe that's CNS hypoxia.
And SARDs often has those preceding signs, right?
Hmm.
Drinking more, eating more, weight gain.
Exactly. That history is critical for SARDs. Whereas something like PRA is usually very gradual. Worse in dim light first. Might seem sudden if the environment changes, but the decline was slow.
And cataracts are usually a history of gradually increasing cloudiness. Optic nerve hypoplasia is from birth.
Right. And if there are other neurological signs happening alongside the vision loss, like seizures, circling, head tilt, that strongly suggests the problem is in the optic nerve or the CNS.
What about checking the pupils? How they react to light?
The pupillary light responses, or PLRs, very useful. They're usually normal if the blindness is from cataracts or way up in the visual cortex of the brain.
Okay.
But if the problem is in the retina or the optic nerve itself, the PLRs are often sluggish or, totally absent. Big clue there.
And looking inside the eye with the ophthalmoscope, what can that show or not show?
Well, that's interesting too. Ophthalmoscopy can look completely normal with SARDs, or if the optic neuritis is behind the visible part of the nerve head, or if the lesion is in the brain.
So a normal look doesn't rule out blindness.
Not at all in these cases, but it will often show abnormalities with the retinal detachment. You can see the detached retina, or with diseases affecting the visible optic nerve head itself.
Okay. What about lab tests? Blood work, urine tests.
Often they're normal unless there's an underlying systemic disease causing the eye problem, but they can give pointers. High blood sugar and sugar in the urine points to diabetic cataracts.
Right.
Certain liver enzyme changes, like high ALP, might support Cushing's, which is sometimes linked to SARS. And in cats with retinal detachment, you might see signs of kidney issues or hyperthyroidism on the blood work, hinting at hypertension.
Are there more specific tests sometimes,
Yeah.
like for lead or infections?
Yeah, if optic neuritis is suspected, testing for lead or doing serology for certain fungal or viral infections might be done. Maybe tests for Cushing's like the LDDST, SARS is on the list. Oh, and interestingly, sex hormone imbalances are often seen with SARS too.
Huh, okay. What about imaging? X-rays, ultrasound?
Ocular ultrasound is really useful, especially if the front of the eye is cloudy, like with a dense cataract. It can see behind that, check for retinal detachment or maybe an optic nerve mass.
But regular skull X-rays aren't much help.
Not usually for blind quiet eye, no. But advanced imaging, CT or MRI, that's crucial if you suspect a problem in the orbit, around the eye, or within the brain itself, essential for CNS causes.
Makes sense. And then there's specific eye tests.
Right. A good pen light exam can sometimes spot dense cataracts or major retinal detachments. Ophthalmoscopy, as we said, looks for PRA signs or optic nerve disease. Measuring blood pressure is vital, especially if detachment is suspected.
And that ERG test,
Ugh.
electroretinography?
Yes, the ERG is super helpful when you're not sure if the problem is the retina or something further back, like the optic nerve or brain. It measures the retina's electrical response to light.
So it tells you if the retina itself is working.
Essentially, yes. If the ERG is flat or abnormal, the problem is likely retinal, like PRA or SARS. If the ERG is normal, but the animal is blind, the problem is likely optic nerve or brain.
Okay. And maybe a spinal tap if a neurological cause seems likely?
A CSF tap, yeah, cerebrospinal fluid analysis. That might be done if neurogenic causes are high on the list.
Wow. Okay. It's definitely a thorough process to track down the cause. So once you have a diagnosis, what about treatment?
Well, the first thing the sources stress is getting that definitive diagnosis before starting treatment. And considering referral to a specialist, a veterinary ophthalmologist, is often a really good idea.
That makes sense.
And it's also really important to reassure owners. Most causes of blind quiet eye aren't fatal, they aren't painful, and blind pets can actually adapt really well and have a good quality of life.
That's crucial information for owners facing this. What advice do they usually get?
Assessing the home environment is key, removing hazards, making things predictable for a blind pet. And critically, not breeding animals diagnosed with genetic conditions like PRA or hereditary cataracts.
And checking related animals too.
Yes, examining relatives is recommended for those hereditary conditions.
Are there specific treatments for specific causes?
Sometimes. For retinal detachment, strict rest is usually advised to help it reattach. Maybe a calorie-controlled diet if inactivity is leading to weight gain. For nutritional retinopathy in cats, obviously, supplementing taurine is essential.
But for some conditions,
Yeah.
it sounds like there isn't really a cure. Like SARS, PRA, optic nerve atrophy.
Unfortunately for SARS, PRA, end-stage optic nerve atrophy, and optic nerve hypoplasia, there currently aren't effective treatments to restore vision. That's the hard reality sometimes.
But surgery can help in some cases.
Oh yes. Surgery can be very successful for removing cataracts, repositioning luxated lenses, and repairing certain types of retinal detachments.
What about medications? Any drugs used?
It really depends entirely on the diagnosed cause. But if a full workup is impossible and infection seems unlikely, vets might sometimes try systemic steroids like prednisolone for suspected SARS or retrobulbar optic neuritis, maybe with an antibiotic too.
But steroids aren't always okay.
Right.
Like if there is an infection.
Absolutely not. Corticosteroids are contraindicated if infectious optic neuritis or retinal detachment is suspected, as they suppress the immune system, could make things much worse.
Are there alternatives?
The notes mention possibly using flunixin miglumin and NSAID in dogs if infection isn't ruled out. And sometimes another immunosuppressant, azathioprine, might be tried for immune-mediated retinal detachments, but that needs careful blood monitoring.
Okay. So once treatment starts, what's the follow-up like? And what are the potential downsides or complications?
Regular recheck eye exams are really important. Monitor inflammation, check vision if possible. Owners should know that with optic neuritis, vision loss can unfortunately recur, sometimes much later.
And complications?
Well, the worst case is death from a severe underlying systemic disease, though that's related to the primary illness, not the blindness itself. Permanent vision loss is obviously a major one. Sometimes eye removal might become necessary down the line if chronic pain develops. And obesity can be an issue, either from inactivity or directly from conditions like SARS.
The information also included a flowchart, didn't it? A diagnostic one.
Yeah, it's quite helpful. It basically walks you through the decision process. Like, is the front of the eye clear or cloudy? Is the fundus, the back of the eye, normal or abnormal on exam? And based on those findings, it guides you towards likely causes like cataracts, detachment, PRA, SARDS, optic nerve issues, or CNS problems, and suggests the next diagnostic steps.
This has been, well, a really thorough exploration of blind quiet eye. It's clearly not simple.
Not at all. I think the big takeaway is that it's not one disease. It's a symptom, a sign that something's wrong somewhere along that whole complex visual pathway,
Right.
and often without those obvious external clues.
And it just highlights again how crucial that methodical diagnostic workup is. You really have to pinpoint the cause to manage it effectively.
Absolutely.
So thinking about how interconnected the visual system is with everything else, it makes you wonder, doesn't it? What other health issues, things that seem totally unrelated, might potentially impact an animal's sight? It really emphasizes that systemic connection.
That's a great question to ponder. It really does broaden the perspective. Well, thank you for bringing this topic to us for this deep dive. We really hope this discussion has given you a much clearer and more insightful understanding of blind quiet eye.